Hello everyone. I'm Dr. Arul Selvan, consultant gastroenterologist, hepatologist from Coimbatore, Tamil Nadu. So, on the day of World Hepatitis Day on July 28th, I wish to share some fact about the hepatitis and those factors that will affect the liver. So, what is hepatitis? Hepatitis is an inflammation or infection of the liver. So, it will cause swelling and inflammation of the liver. So, this hepatitis can be caused by various things. Okay, but most commonly by alcohol and recent times the fat which is deposited in the liver causing fatty liver. Okay. Then another part is infections that will affect the liver. So there are 5 types of infection: the hepatitis A, B, C, D, and E. So among this, hepatitis A and E will be spread through contaminated water and unhygienic food. So anyone who is taking unhygienic food from roadside shops and hotels and from the unhygienic person who serves the food, they can acquire this hepatitis A or hepatitis E. So, and hepatitis B and C can be spread through blood and contaminated body fluids. So this can be spread by sharing needles or sharp objects. For example, those who are sharing razors and those who are doing tattooing with the same needles without sterilizing it, they can get it. Or without doing any proper screening of blood products, if they are transfused, and they also will get the same hepatitis B and C infection. And once they acquired the infection, they will develop hepatitis. Once the patient develop hepatitis, they will have, what are the symptoms of this hepatitis? Main thing is fever followed by body pain, fatigue, tiredness, headache, and jaundice. Jaundice means yellow discoloration of eyes and body, and sometimes they will have dark yellow urine. And once if your family members or any patients attenders notice that patient has got jaundice, you should seek attention of the doctor. And if it is not treated, it will lead to catastrophic liver disease. Once it develop a hepatitis, sometimes if it is not treated, and hepatitis B and C will progress to chronic disease, and they will develop cirrhosis and liver cancer. Cirrhosis means shrinkage of the liver. Sometimes if it is persists for more than 6 months to years together, they also develop liver cancer. So to prevent the development of this liver cancer and hepatitis related cirrhosis, we need to detect these viruses very early and treat them very early before developing uncontrolled cirrhosis and other complications. Okay, so these are the complications of this hepatitis and how to prevent this. So to avoid getting these infections, we should avoid sharing razors, sharp needles, and other utensils, other objects which is shared by the infected persons. And once the family members has got this infection, and all the family contacts members should be screened for the infection, and if they are negative, they should be vaccinated for hepatitis B. And there is no vaccination for hepatitis C. Once they have hepatitis, you should seek advice from the specialist like hepatologist, and you should get treated with antiviral drugs. And hepatitis A and E are spread by the water and food. So you should avoid taking unhygienic water and unprotected water and food from the other hotels. And you should wash your hand after coming from the toilet, and you should cut your nails frequently, and personal hygiene should be maintained properly, and all the sexual practices should be very protected. And pregnant ladies, especially pregnant ladies, tend to get hepatitis E infection and also B, C infections. So they should be vaccinated they should be tested for all these tests, all these viruses, and they should be get vaccinated. And these are all about hepatitis. And main thing is balanced food you have to take, and you should avoid drinking alcohol, because alcohol also will produce severe alcoholic liver disease, and they also develop into cirrhosis and liver cancer. So once cirrhosis develops, it is very difficult to bring them back. So liver transplantation is the main treatment option if they develop cirrhosis. To prevent development of the cirrhosis and liver cancer, should avoid drinking alcohol. We should take a proper and balanced diet, and we should take protected water and hygienic food intake, all important. You should get vaccinated against hepatitis B and C. And you should create awareness to other people, those with jaundice. And you should not take any medications, unprescribed medicines from the doctors, from the medical shops and other quacks. Those are not registered medical practitioners. So on this day of World Hepatitis Day, let us, this is a time to action. That is a WHO's theme for this Hepatitis Day. So we'll take oath to save our liver, and will detect early lesions, early signs of liver disease, and live long. Thank you.